In the 1960s, the scope of NLM was radically expanded by both the Congress and the Secretary in terms of creating our first intramural research division, the Lister Hill National Center for Biomedical Communication, transferring the Public Health Service audiovisual facility to the National Library of Medicine from the CDC, just radically expanded what the library did.
The satellite group was having trouble finding anybody that wanted to use satellites. So we got about 3 medical libraries in the northwest part of the country and set up a direct communication between Alaska and the Library of Medicine. And we transmitted excellent data that needed and relied on medical images.
High-speed computer networks are under development, and the foundations for that network are already in place in a really global network called the Internet.
We'll take a little adventure with your United States Senator here and see what he can do by introducing the Internet Grateful Med.
The superhighway on medical information will now become a freeway.
This development by itself may do more to reform and improve the quality of health care in the United States than anything else we've done in a long time.
I mean, we actually at NLM alone answer 1 million inquiries a day.
A day?
A day. It's a staggering amount. It's going 400 million a year.
It was evident to us if we could get involved in this type of a project, we could bring our access out to people in rural Iowa. NLM has really provided the seed money for a project that's no longer a research project, it's practice now for us.
This is a tremendous accomplishment. In fact, SNOMED is going to be distributed by the National Library of Medicine through its Unified Medical Language System.
I get a call from Don Lindbergh asking me to be regent. And I says, I don't get it, you know, it's a library. He says, well, libraries are just collections of data, aren't they? And we see imaging as just as important as books. I went, that's enlightened, yeah.
We have a personal health record that's now demonstrable. This is based on web technology as feature-rich as a desktop application would be. The key data input is coded into NLM-supported vocabularies.
Oftentimes it's the National Library of Medicine that I turn to, and not just as a reporter, but also as a doctor. ClinicalTrials.gov is a place that I often send my patients.
The national importance of that resource for patients and families and really for the world continues to make a difference, I think.
People had associated the National Library of Medicine perhaps with the adjective venerable, but a little staid and conservative. And we took it right to the other end of the slider bar in terms of adventuresomeness and doing things that we didn't quite actually know how to do with Unified Medical Language System and creating NCBI and new avenues in digital imaging and new services in an interneted world. So that was a very heady time.